Thank you for having me. Distinguished guests, officials, and esteemed colleagues, thank you. Thank you to Artifact and thank you to Damian for inviting me. I'm truly honored to have been invited to address you today in the heart of Paris, a city famous for forging timeless advancements that shape the humanity's journey forward. Fittingly, I come today to discuss the 21st century AI that may reshape our next revolution in the global healthcare. In the last few years, we have seen technology advanced by order of magnitude. We could have reasonably expected that, especially when it comes to the patient-centric healthcare. As the French master of letters Victor Hugo wrote, all the forces in the world are not so powerful as an idea whose time has come. Similarly, healthcare AI represents an idea whose era has firmly arrived to alleviate suffering and extend the human lifespan to the heights previously unimaginable. 2023, can you believe it? It's coming to an end. But it has been a beacon year. AI is dynamic. It's reshaping our reality. With declining computing costs, rich internet data, strategic investments in large language models, LLMs, AI is no longer the future, it is the present. Our world is on a precipice of transformation, of a revolution, driven by AI's unmatched power. The destiny of this revolution is in our hands, ladies and gentlemen, offering us unparalleled opportunity to harness power and spearhead technological renaissance. Today, we will explore how AI is not just another buzzword, but a very powerful tool, revolutionizing and rehabilitating a very world we live in. This is a story of my new book, Our Planet Powered by AI. Sorry, a selfish plug here, but it's coming to all the bookstores. Already came to New York. But I will tell you before jumping into the healthcare, strategic blueprints are already being drawn for the ambitious 2024. Generative AI integrated and transitioning from an asset to a necessity. Legal and regulatory environments here in Europe and the United States are evolving. Transparent data practices remain paramount. And everything is being aligned with LLMs and tailored KPIs. We are now beyond the figures. We're looking at digital labor market at the $3 trillion. It is unbelievable. We're seeing things evolve to an unbelievable level in the area of equity investments. 2023 has emerged as a landmark year for generative AI. It attracted staggering $14 billion in equity funding across 86 deals in the first part of the 2023, eclipsing $2.6 billion amassed in 2022. Generative AI startups are a beacon of growth. They're witnessing year after year surge in the median pre-money valuations, even as other sectors suffer at 24% downturn. It is a boom. Meteoric rise of 18 generative AI entities achieving unicorn status, valuations over $1 billion. We are going to finish, most likely globally, at a $42.6 billion of investments by 2023. And the enthusiasm is coming from every sector of the corporations. It's coming from NVIDIA, Salesforce, everybody. That is the future. We are seeing that today, as we gather here, an important momentum in health, in the rates that are surging right now, preventable chronic illness, coupled with strained professional workforce. AI offers us a medicine, a roadmap towards predictive, personalized, and preventative care model, unlike ever before. Implementation of this technology is going to uplift the quality of our life. Communities worldwide. Healthcare professionals are already using AI from everything, from forecasting emergency department volumes to staffing, to predicting which treatments might be most effective. I'm honored to have the opportunity today for a few minutes to exchange perspectives with you on directing healthcare AI ethically, to unlock its full potential ethically. In the subsequent minutes, we explore some cases, considerations, and responsible development and vision in the future where medicine finally conquers disease than chasing it. I invite all of you today to envision this future. This future as we traverse the frontiers of the AI-powered healthcare. What it means is that we have to respond intelligently, rather than explicit support. Within the healthcare world, AI empowers detection of early diseases, signals via data patterns, imperceptible to physicians alone. It facilitates classifications of conditions, prediction of future patient risk trajectories, and recommendations of therapeutic inventions, most likely to benefit individuals based on their molecular profiles. All of this would seem like science fiction a decade ago, but today, healthcare AI, as you have seen at this conference, has come. It has secured its stay mainstream. Behind the scenes, your doctors likely utilizing AI to analyze scans, pathology slides, hereditary markers guiding treatment patterns. AI chatbots even support patient triaging and administrative activities. In healthcare, as you know, through analysis of massive medical data sets, AI recognizes patterns leading to predictive outcomes. Remote patient monitoring via AI-powered variables continuously collect data, allowing healthcare to providers to intervene promptly. AI algorithms in the algorithmic economy in 2023 play a significant role in assisting radiology, X-rays, CAT scans, MRIs. So have we ever pondered about disease prevention instead of a cure? AI models sift through terabytes of patient data, offering insights unimaginable to human eye, opening doors to preemptive care. We're in a proactive, preemptive, predictive medicine, detecting diseases at the earliest stages and waiting for irreversible damage is a huge step in the right direction. Supporting doctors in providing treatment earlier could lead to better patient outcomes. We are using large amounts of data, such as medical images, medical history, patient records, genetic information, and lifestyle data. Professional medical practitioners can use AI to build early detection algorithms. Working with vast quality and quantities of such data requires validation, an ethically founded approach to AI. Diagnostics. One of the most significant advantages of AI in healthcare lies in the ability to enhance diagnostic speed effectively, providing evidence-based recommendations to help them during patient care. Radiologists are using natural language processing, NLP, to augment their work and improve their interpretation of scans. By analyzing X-rays and MRIs, AI identifies patterns and anomalies that may be overlooked by humans. We're in the era of accelerated research breakthrough in drug development. Conventional drug development and approval process takes over 8 years and costs $2 billion. AI-generated drugs and clinical trials revolutionizes this process in a snap. Many startups are using generative AI, as we have seen here, to forecast and properties of proteins, and drugs can predict interactions, which now optimizes new candidates for drugs. Real-time patient monitoring. We're seeing what Apple Watch, Fitbits are doing, smartwatches, continuously monitoring patient health and transmit real-time data. That could alleviate unnecessary hospital visits. Let's look at the glimpse of the future. Healthcare research is experiencing a transformational change. Moderna, a company announcement of the heart and disease vaccines available by the end of the decade, is a prime example of this, all with the AI's help. We could imagine the world where pandemics are quickly contained and chronic diseases are eradicated. Clinical decision support. Algorithms process vast amount of patient data. Recommendations, especially at the point of care, ensuring patients get best possible advice and treatment. Personalized medicine, tailoring treatment specifically on patients that have genetic and lifestyle data changes that could specifically focus on them, only them, enhancing outcomes and reducing side effects. The merger of biology and AI is nothing short of remarkable. It is here today. Real-world healthcare vignettes. Allow me to share a little bit as we approach almost the end of my presentation, but I'll take you for a few more minutes. When coronavirus emerged, a technologist, Dr. Kira Radinsky of Israel, responded by developing an AI systemic surveillance tool. It enables public health authorities to geographically map probable diseases spread by having citizens report symptoms. This also allows hospitals to strategically prepare staffing and beds. On this very day, on her first very day, The monitoring system went nationally. It identified 200 infectious individuals, not yet isolated. It forecasted and helped to contain pandemic, and that was that was actually used by many countries. Then you have in my city, in New York City, in Big Apple, you have immunotherapy outcomes that are improving lung cancer by using predictive, personalized, and precision medicine. By considering patients' medical history, genetic makeup, lifestyle changes, and environmental AI algorithms assessing risk, predicting medical outcomes. At Memorial Sloan Kettering Center in New York, my good friend, Chief Technology Officer Zvi Gal, is working with his team on combining AI imaging analysis with genetic biomarkers to determine which lung cancer patients respond best to the cutting-edge immunotherapy versus chemotherapy. By finding those patterns and linking those patterns, the scan's visual features and RNA sequencing are using predictive model sequencing, improving accurately forecasting how tumors will react to treatments. Zvi and his group overseeing the implementation of the most advanced AI technologies in the world at Memorial Sloan Kettering, providing exceptional patient care and also focusing on cancer research. Under his leadership, AI systems was trained to actual patient data and identifying image signatures that correlate with gene expressions. This is the future of AI. And finally, in addition to the Memorial Sloan Kettering, they introduced the first ever chatbots and virtual health assistants to provide patient answers, provide information and support using the platform called Amelia. And the study conducted by NYU, researchers assessed the feasibility of using ChatGPT or LLMs to answer extensive questions about your diseases with electronic health records. So we're moving data to decisions. We're transforming raw data into life science decisions. This is the magic of personalized medicine. Few words, ethical considerations. Amidst healthcare's AI immense promise, we must thoughtfully incorporate ethics and responsible AI to ensure benefits are distributed equitably to everyone. How can we proactively address issues like data privacy, algorithmic transparency, accountability? Which communities are most vulnerable? Which ones are neglected? What could I do? How could we improve inclusive development? So finally, the inspiring future of healthcare AI is here. I am inspired, I'm sure you are inspired. AI is shifting from medicine, from reactive to prescriptive, to preventative. We're foreseeing the world where most diseases become predictable, and we're predicting them before symptoms appear. Patients are now receiving uniquely tailored treatments for the molecular drivers of their conditions. And doctors finally have capacity to focus their precious time on holistic, long-term caring relationships and repetitive tasks. Healthcare AI promises accelerating discovery of lifestyle therapies through amplified research. It democratizes quality care across villages, nations, by overcoming geographic distances. And it can form technology substrate, including enabling precision nutrition, fitness, and well coaches. Robotic surgical equipment is already taking place. Few words. Make no mistake, AI will revolutionize healthcare and empower and extract fashion based on foundations we lay today. This is a pivotal moment in our life, 2023. This is a history together you and I are making in democratizing quality care to liberate human potential, to invertedly that widens no more divide in healthcare. And finally, I once read that the future has yet been written. Therefore, I implore you to go forth writing humanity's next chapter with me, where AI alleviates the suffering of human beings with diligence and compassion as allies in this room. I believe we're destined to succeed, and we are going to succeed. It's an era that begins realizing healthcare abundance, not just for elite, not just for most powerful, not the most powerful G7 countries, but for uplift communities everywhere around the world. The time for transformative healing is now. I sincerely thank you for sharing this visionary glimpse of the new medical frontier that I outlined. As a pioneering oncologist, humanitarian Sidney Farber said, the cure for cancer lies in the courage of few pioneers, a few patients, the will of researchers, and the giving of donors. May the spirit propel us towards the AI-powered future of healing and hope. Thank you so much. Best wishes.